Very good evening to everyone. How is life going on? Welcome back to Edu Skills, OET made easy. How nice to make you fall in love with OET. If you're watching this on YouTube, kindly consider subscribing the channel, give us a thumbs up if you like our work, and share this video to your contacts so that we reach out to maximum number of OET aspirants, especially those who are financially struggling to crack OET. All the services at Edu Skills are free of cost, no payments of any sort. And you can find the links of the recordings in the description given below. Please share so that we reach out to those who are financially struggling to crack OET. Okay, keep smiling. We have been looking into different types of text that we have in reading part B. Today we will be looking into notice. You have heard of notice. This particular notice says something. And the previous session we have looked detailed into the guidelines. Today we'll be dealing with part B, notice. You know what is a notice, right? Just try to imagine, visualize what are the questions that will come to your mind. We are telling you that there is some offline program, OET training. And could you ask me some questions regarding the same?
Who are eligible?
For whom is it? Who are eligible? Is location. Okay, location.
Duration of the course, Father.
Yes. What else?
What date? Fees of the course.
Fee structure. This could be a notice. This will be with some pictures, but your notice that you have will be in the format of a text. This is a notice about the program that we have from April 4th to 21st offline program. So let's check how does it work. Now, this is a notice. So the questions could be, as you said, what is the program? Who is organizing it? For whom? Beginners, advanced, crash course. When, date and duration. Why? Aim or purpose of the course. There's a spelling mistake, of the course. Course structure. Which subjects will be dealt with. Fee or payment. Okay. So whenever you see something, a notice, or as we said, the guideline also has got a structure, you have to visualize as if you are planning to attend this program, or you are going to interact with those people. Okay. And as we get into sample 5, part B, question number 1. Let's check. This is a notice. According to the notice, the course is only available to nurses who. So which question it answers? Who are eligible, right? According to the notice, the course is only available to nurses, particular group of nurses. Not to all the nurses, particular group of nurses. Okay, we'll just listen to this one. It's also a listening practice for you. Listen and try to understand for whom is the course.
According to the notice, the course is only available to nurses who wish to apply for a hospital internship, are prepared to pay for the course themselves, are already employed in a related field. Notice. Emergency Nurse Practitioner, ENP Minor Injury Course. We are pleased to announce that the hospital's ENP service will be running a minor injury course. The aim of the course is to prepare experienced registered nurses working within emergency, primary care and walk-in environments to provide a high level of autonomous care for patients presenting with minor trauma. The ENP minor injury course structure has recently been changed. There will no longer be an additional clinical placement, and course applicants will therefore be required to complete all their clinical competencies in their own clinical setting with a designated mentor, with whom we will correspond in advance of the course. Therefore, only applications from registered nurses working in a nursing role on a permanent basis, in a relevant area such as the emergency department or minor injuries unit within their organization can be considered, and their place will need to be funded by their organization, rather than self-funded.
Okay, so those who are familiar with the system can interact. If you have no distractions in the background, keep smiling and interact, okay? According to the notice, the course is only available to nurses who, particular group of nurses. First one, wish to apply for a hospital internship. So what is the hedging word?
Hospital internship.
Hospital internships, okay. Then?
Pay for the
course.
Yes.
Pay for the course.
Pay for the course means fees. Those who are prepared to pay for the course. Then?
Employed
in a related field. So coming to the topic sentence, do you have any clue here? The aim of the course is to prepare experienced nurses working in emergency, primary care and walk-in environments to provide a high level of autonomous care for patients presenting with minor trauma. That is the topic sentence. So for whom is the training? Any idea you got from your listening or reading?
Registered nurses working within emergency.
Registered nurses working.
Registered nurses?
Working with
Working
emergency,
within emergency.
primary care and walk-in environments.
Is there any similar option in the question?
The employed related field.
Option C.
Employed
C.
in a
C.
related.
Related field.
Related field.
Okay. Do you see? Therefore, only applications from registered nurses working in a nursing role on a permanent basis in a relevant area.
Relevant area.
Relevant?
Area.
What is the synonymous expression of relevant area?
Related
Related field.
Related field. So that is relevant area. Only applications from registered nurses working in a nursing role on a permanent basis in a relevant area, such as emergency department or minor injuries, unit within the organization can be considered, and their place will need to be funded by whom?
By the organization.
Funded by
By
their
the
Organization.
organization. So, should they be prepared to pay the fees?
No.
No, that is eliminated. And do they speak something about a hospital internship?
No.
No.
There will be no longer be an additional clinical placement. And course applicants will therefore be required to complete all their clinical competencies in their own clinical setting with a designated mentor. Here it says there will no longer be an additional clinical placement is hospital internship, right?
Yes.
Yeah, wish to apply for a hospital internship. So here it says no longer be an additional clinical placement. There is no hospital internship available. So that also can be eliminated. All these eliminations are not required, as we know the thing. This is only for the practice purpose. So you know how easy it is. The clue is here. Registered nurses working within emergency, primary care and walk-in environments provide a high level of autonomous. And again, it is therefore. It is repeated only applications from registered nurses working in a nursing role on a permanent basis in a relevant area. Okay, so let's check into the structure of this one. I'm teaching you in detail so that you understand the whole thing and try to grasp. Okay, so this is the notice. You have the heading first. Then you have who is organizing and what is the program. We are pleased to announce that the hospital's ENP service will be running a minor injury course. Then you have for whom. Topic sentence speaks. For whom is the program? And the question is on the topic sentence, for whom is the program? Why? Aim or purpose of the course also is mentioned in the topic sentence. Then you have course structure. The ENP minor injury course structure has recently changed, and then she is speaking about course structure, also clinical placement, all those things which are not at all relevant for us, provided we understand the topic sentence. Then you have for whom, repeated. Again, the whole thing is repeated. The topic sentence, it says for whom, again it says for whom at the end. So it is repeated. The answer is stressed and repeated. Okay, at the end says funding or payment by whom. That is B option, are prepared to pay for the course themselves. They need not pay for the course because the organization will be paying for it. So easy it is, provided you visualize, understand the text. So sample 5, part B, text 2, question 2.
2. The guideline about breast pumps restricts their removal from the ward, provides operating instructions, indicates times of unavailability. Maternity ward guideline for 3.7. Electric breast pumps. All inpatient areas that care for infants of expressing or breastfeeding mothers have been allocated electric breast pumps. These should stay on their allocated ward except for when they are being cleaned. They are exclusively for use in the infants ward area and should not be given to parents to take to their own accommodation in addition to the ward-based pumps. There are expressing rooms containing electric breast pumps around the hospital. All the expressing rooms can be used by mothers of patients in any ward area as well as by mothers visiting outpatients. Breast pumps are now all tagged to enable pumps to be tracked and found quickly. A breast pump can be shared between mothers on a ward but should be wiped down by the mother after each use. Breast pumps are cleaned by the hospital sterilization and decontamination unit weekly.
Okay, hope you got the answer. The guideline about breast pumps, already we have seen in detail the structure of guideline. Any idea?
B.
What is the topic sentence? What are the heading words?
Restrict.
Restricts the removal. Then operating
Operating
instructions.
instructions,
Then
indication,
Times of unavailability.
Availability.
now here it says in the first part, all patient areas that care for infants of expressing or breastfeeding mothers have been allocated electric breast pumps. These should stay on their allocated ward. These should stay. This means
breast
breast
pumps,
pumps
Breast pumps.
should
Stay.
stay on their allocated ward. Restrict their removal.
Yes.
This is a paraphrasing, right?
Yes, Father.
Restrict their removal from the ward. These should stay on their allocated ward,
Ward.
except for when they are being cleaned. Only when for the purpose of cleaning, you can change this side, take this side, remove this side or that side. Otherwise, it must stay. It should stay on their allocated area. You cannot remove. That's what I said. If you understand the topics and it's the main allocated area, you need not read the whole thing. Okay, there is no operating systems mentioned at all. How to operate, how to switch it on, how to switch it off. Nothing is mentioned. And about unavailability also they have mentioned. So it's clear, right?
Yes, Father.
Yes, Father. Yes, Father.
If you
Yes,
have no
Father. Yes,
distractions, set back.
Got it.
We go to the third one. Just listen and try to read as well.
3. According to the policy, what must the registered nurse do when a patient is discharged? A. Check the clarity of aftercare instructions. B. Liaise with other health professionals. C. Ensure easy accessibility to patient data. Hospital discharge policy for 1. 5 registered nurses will have the responsibility for ensuring advice on discharge is provided to patients and, if required, relevant onward referrals are made including the booking of future outpatient appointments. The registered nurse must ensure that all relevant documentation is complete and accurate. Registered nurses will ensure effective handover both verbal and written of patients' assessment and ongoing care needs. They will also be responsible with the support of the discharge coordinator, where appropriate for day-to-day coordination of discharge and act as a point of contact and conduit for effective communication for all members of the multi-disciplinary team. They must ensure that all requirements to facilitate a safe discharge are in place. This may include dressings, medication, and any equipment.
Okay, what are the hedging words? What must the registered nurse
Registered
do?
nurse.
Registered nurse.
Yeah, what are they supposed to do when a patient is discharged? And here, A option,
Check the clarity.
A
Aftercare.
option, aftercare
Aftercare
instructions.
instruction.
Yes.
Aftercare
Then
instruction.
C,
Lies.
B,
Liaise with
liaise,
Lies.
yeah, with
The-
other
Other
health professionals. Then
Ensure.
patient data.
About
Third one is
patient
patient
data.
data. What does the
Father, option A for me.
top
A.
aftercare instructions? Okay, where do you have it?
Father, they
Registered nurse
must
must
ensure
ensure
that
that
all
all
requirements
relevant
of
documentation is complete and accurate.
facilitate and safe discharge
Yeah,
are in
this
place.
is a problem that you should be very careful. This is not the right answer. There is a scale expression. The registered nurse must
Must.
ensure that all relevant documentation is complete and accurate. All relevant documentation. As nurses, you know, when you have a discharge, it's only the documents means only aftercare instructions, or what else is included in the documents when you discharge?
Referrals
Before
and
appointments.
appointments.
Referrals, revisits,
Appointments.
medications,
Admission procedure.
managements. So all these are included when you say nurses must ensure that all relevant documentation is complete and accurate. This says all, but the option A says only one.
Oh,
Do you get me?
yes, Father.
This is the trick they play in almost every material. You will have these type of questions. As nurses, you should visualize. Is it only aftercare instructions when you discharge a patient? That's the only document you have? No.
No.
You have so many other documents, right?
Yes.
Yes, Father.
Yeah. So that can never be the option. All is not one. All is
Yes,
not
Father.
One.
one. And not only for this material, work out this type of materials and write down and understand why this is wrong. Otherwise, it seems you can suddenly go there. Okay, that's not the thing. Okay, and accessibility to patient data.
Last line, Father. They
Last,
must ensure that
that all
requirements.
requirements to facilitate a safe discharge are in place.
this may include
May
dressing,
include
medication,
dressing,
and
medication, and
equipment.
any equipment.
Is it patient data? Dressings,
No.
medication,
No,
and
Father.
equipment?
No,
No.
no.
No,
No, Father.
the whole text doesn't speak anything about patient data.
Patient data. Yes, Father.
It doesn't speak anything about patient data. This is not given in the text.
Option B.
Patient data means the details about the patient history and all those things, patient history and other things, everything, whatever the diagnosis was done, all those details.
Diagnose.
So lays with the
Other health
Other health
professionals.
health professionals is the only one left. Let's check. Is there any possibility? Now you see,
Word relevant on
relevant. See, relevant, if required, relevant, onward referrals are made. What does it mean? Referral to whom? Some other health professional, right? You don't refer to the mechanical engineer. Okay. Referrals are always to other health professionals. Okay, other health professionals.
And also booking of future outpatient appointments also, Father. So B is correct.
Yeah. Again, you have booking of a future appointment. Again, where do you have it? See, you should act as a point of contact and conduit for effective communication for all members of the multidisciplinary team. Does it include other health professionals than you? Yeah. Again, it speaks. As I said, repeats. The answer is repeated again. See, when there is a policy, then when you are supposed to do something, there is a structure. So this is clear. Let's get into the structure of this particular type, since you have one new learning. It's not a new learning, but you did not understand previously, I believe. So let's check this. Okay, responsibility of the registered nurses. Okay, heading is registered nurse. What are the responsibility? One, ensuring advice on discharge is provided to patients. Second, relevant onward referrals are made. Third, booking of future outpatient appointments. Fourth, all relevant documentation is complete and accurate. Versus aftercare instruction, option A. General versus particular. General versus particular. Understand that. Nice. Get into this text and write down and understand. And suddenly it clicks when you have the next time you have it. Suddenly it will click. That's why the students will go and say, it was so easy. I answered everything, but I got only 290. Because you think that is the right one. You are convinced of that. Okay, fifth responsibility of the nurse, handover of patient's assessment and ongoing care needs. Sixth one, day-to-day coordination of discharge. Seventh one, act as a point of contact and conduct for effective communication for all members of the multidisciplinary team. In this A1 here, fourth option, other options are not mentioned here in 3 options, right? That speaks about patient data, aftercare instruction, and liaise with the other health professionals. Only the B1 is given, and A1 is given to make you understand that you are competent to understand the general statement and a particular statement. All and one. Sometimes they will say all and many. Sometimes they will say all and some. Sometimes they will put all and two. Sometimes all and one. Always beware of this particular strategy where you'll be tricked. So just let's see these 3 options. See, this fourth option is A1. Check the clarity of aftercare instructions. But we said that is not the same. Both the statements are not same. One is general, text speaks general, and the option A speaks particular. And liaise with other health professionals. That is in the topic sentence, as well as 7th instruction, responsibility of the nurse. Okay, that's cool. Hope you are not tired, right? Exhausted?
No. Not, Father.
You have the stamina to go on.
Go.
Yes.
Yes, Father.
Listen and read.
4. This notice provides information about the potential dangers that NGTs pose to patients, the precautions to be followed during the procedure, the correct technique for inserting a nasogastric tube. Notice nasogastric tube NGT. By inserting a nasogastric tube, you are gaining access to the stomach and its contents. This enables you to drain gastric contents, decompress the stomach, obtain a specimen of the gastric contents, or introduce a passage into the GI tract. This will allow you to treat gastric immobility and bowel obstruction, and permit drainage in drug overdosage or poisoning. NG tubes can be used to aid in the prevention of vomiting and aspiration and for assessment of GI bleeding. They can also be used for enteral feeding initially. The potential for contact with a patient's blood-body fluids while starting an NG is present and increases with the inexperience of the operator. Gloves must be worn while starting an NG, and if the risk of vomiting is high, the operator should consider face and eye protection as well as a gown.
Yes. The notice, again, you have the notice, right? Provides information about question. This is about, okay, we call it about question. About potential dangers. Hedging words, dangers. Next.
Precautions.
Precautions.
Correct technique.
Correct technique of inserting. How to insert. Inserting NGT. Precautions to be followed. Dangers, potential dangers. So any idea? See, very fact by inserting nasogastric tube. Very fact, it begins with that statement. It says inserting is over. They are going to speak after inserting what is going to happen. Right? See, by inserting a nasogastric tube, you are gaining access to the stomach and its contents. The insertion is over. Insertion is over. You have got access to the stomach and its contents. This enables you to drain gastric contents. What happens after inserting? The whole text speaks, inserting is over. By inserting a nasogastric tube, you are already inserted. You are gaining access to the stomach and its contents. Now you are going next step. This enables you to drain gastric contents. What does it speak?
Precautions. About the gastric contents and precautions, Father?
No. Can you eliminate using this by inserting an nasogastric tube? The timeline, can you eliminate any option?
Yes,
Option C. C option.
Yeah, C option can be eliminated because it is speaking about technique of inserting. Inserting is already over. We are speaking the stage after insertion. So that timeline is also important. Most of the time you have this technique being used. Now, potential dangers. Do they speak anything about dangers? This will allow you to treat gastric immobility and all those things. So all positive things are said, right?
Yeah.
They can also be used for central bleeding initially. The potential for contact with a patient's blood-body fluids while starting an NG is present and increases with the experience of the operator. Gloves must be used. What does this speak?
Precaution, Father.
Precautions.
Yeah, clearly precaution, right? Gloves must be worn while starting an NG, and if the risk of vomiting is high, the operator should consider face and eye protection as well as a gown. So precautions.
Precautions, yes, Father.
Precautions. Yes. So what is the answer?
B is
B.
Precautions. Yeah. Yeah. So we are not going to detail explanations of all these things because we have seen first one, danger is not given. Third one, versus text after inserting. Okay. Third one speaks about before inserting, but the text starts with after insertion. Okay. Cool. Yes. So we go to the fifth one. Listen and read.
5. In this policy extract, what point is made about clinical guidelines? Their content must be approved by all relevant staff. They are a set of recommendations rather than regulations. Ignoring them for no reason is likely to result in disciplinary action. Clinical guidelines. The development, introduction and use of guidelines is intended to ensure consistent care to all patients and reduce risks of errors and incidents through ensuring the whole clinical team is working in an informed, consistent, and clearly understood way. The policy aims to ensure that clinical guidelines are developed and agreed, keeping all key staff involved and informed as well as reflecting best practice. It is important to recognize that clinical guidelines are not mandatory and are not a substitute for clinical judgment. However, where guidelines are not followed, clinicians should be able to account for why a decision not to adhere to them has been taken. In these situations, it is good practice to record this in the patient notes. Clinicians also have a responsibility to report these instances to those responsible for producing the guidelines in order that such instances can be reflected more accurately within them.
What point is made about clinical guidelines?
Guidelines.
What does it speak about? Clinical guidelines.
Clinical guidelines.
Okay. Approved, their content must be approved by all relevant staff.
Absolute.
Guidelines, are they usually applied by all the relevant staff? When you have a guideline in your hospital, all relevant staff and all the concerned staff will sign under it?
No, Father.
Do you do that?
No, Father.
No. So absolute is there. Always absolutes are
Wrong.
Eliminated.
Eliminated.
absolutes are always eliminated. So immediately you can eliminate this. Yes. So that is done. They are a set of recommendations rather than regulations. They are recommendations, not regulations. Recommendations. Ignoring them for no reason is likely to result in disciplinary action. Disciplinary action will be taken. Ignoring them for no reason means zero reason, right?
Yes,
You understand it? What does it mean?
absolute.
The meaning is absolute. So what happens?
Eliminate.
So what is left?
B.
Only option B.
B.
Okay, if you don't understand no reason is absolute, let's see here. It's important to recognize that clinical guidelines are not mandatory. Guidelines are
Not mandatory.
not mandatory means will there be punishment?
No.
So,
No. If it is not mandatory, no
Recommendations.
punishments, no disciplinary action.
Right. Yes,
Okay?
Father.
It's
Yes, Father.
not mandatory. It is important. Whenever some expressions like it is important, it is significant, such expressions are that, definitely beware of that. The answer will be there somewhere around. It's very important. Okay? And also it says this is, somewhere it says it's a best practice. Say good practice. Good practice means good practice means it's good to do, not mandatory.
yes.
It's a good practice to have 2 or 3 liters of water every day. It's a good practice to have more fluid intake. Again, one more word was there somewhere. Best practice. See, best practice, reflecting best practice. All this says it is not mandatory. This is a best practice. This is good practice. It's better to do this. So these are recommendations, not regulations. Regulations are mandatory. Recommendations are advices, suggestions.
Advices.
Yeah, and no disciplinary action. Clear, no?
Yes, Father.
See, recommendations, non-mandatory, no disciplinary action, not must. May. Okay, you may do it, or you may not do it. So we get into the last one. Yes, listen and read. It's also a listening practice for you.
6. The protocol instructs maternity staff administering Ferinject to temporarily discontinue prescribing iron tablets, avoid giving it to breastfeeding women, be alert for any negative reactions. Protocol for the use of Ferinject during pregnancy. Ferinject iron 3-carboxymaltose has 50 mg/ml of elemental iron. It is administered by slow IV injection or infusion with no need for a test dose. It should be avoided in the 5th trimester, and it should be administered with caution during the 2nd and 3rd trimesters in cases of severe anemia where iron supplements are ineffective. Less than 1% passes into breast milk, which is unlikely to be significant. While the rate of anaphylaxis with this preparation is low, it does carry a risk of anaphylactoid reaction. It does not require any monitoring except for a set of observations prior to administration. Oral iron should be avoided for 5 days after the administration of Ferinject. A follow-up full blood count should be performed at 2-3 weeks. Adapt to clinical scenario if necessary, and the GP notified of the treatment and need for continuation of iron.
Okay. The protocol instructs.
Yes,
What is the
Father.
instruction?
Administrative.
Maternity
Administer
staff
Ferinject.
administering. If the medical maternity staff is administering Ferinject, what should be done? The instruction is this. What is the instruction? Among these three things, one is the instruction. Protocol instructs the maternity staff. First one, temporarily discontinue prescribing iron tablets. Discontinue iron tablets.
Prescribing iron
Temporarily discontinue iron tablets.
Yes,
Then
Father.
next,
Avoid
avoid giving it to
Breastfeeding.
breastfeeding women.
Breastfeeding man.
Giving it means what?
Injection.
Yeah, Ferinject, right?
Yes.
Yes, Father.
Should not give it to breastfeeding women. Be alert for any negative reactions.
Reactions.
Negative reaction.
Negative reactions. Ferinject during pregnancy. It is administered. What does it refer to?
Injection.
Ferinject. It is administered. So it is administered to whom?
Breastfeeding woman.
Breastfeeding woman.
Mother.
Primary.
Where do you have that idea? Breastfeeding woman?
No. Primary. First trimester.
No. Protocol for the use of Ferinject during pregnancy. Ferinject has to be given during pregnancy, right?
Yes, Father.
Yes, Father.
Yes.
So it is administered by slow. Do you have any problem with any of the instruction options here? When you say, already the statement says you are administering it to the pregnant women.
Pregnant.
So
Option B, limited.
It's
It's
B is
Breastfeeding
problem.
woman.
B is wrong.
Yeah.
Breastfeeding
B is a
woman.
negative.
Can be eliminated.
It's negative.
B is wrong.
So this can be
Eliminate.
eliminated immediately.
Eliminated.
Yes. It should be avoided in the first trimester. And it should be administered with caution during the second and third trimesters in cases of severe anemia where iron supplements are ineffective. Okay.
It does not require any monitoring.
Oral iron should be avoided for 5 days.
For 5 days.
So
after
temporary
the first 5
discontinuation.
days.
5 days
right
is
answer.
synonymous of
Temporary.
temporarily.
Temporary.
Discontinue
Option A,
prescribing
Father.
iron tablets. Prescribing iron tablets means oral iron
Oral iron.
tablets.
Oral.
So the option is first one, right?
Yes, Father.
Yes.
Option
A is right
A,
answer.
Father.
A is right answer. And you see the third one, be alert for any negative reactions. It
Does not
says
require.
Does not
less than
require.
1% into breast milk, which is unlikely to be significant.
Significant.
There no negative reactions for right, considerable negative reactions. They negligent. They say it is negligent. Now you see, temporarily discontinue prescribed iron tablets. Oral iron should be avoided for 5 days. Synonymous
5
expression.
days.
Avoid giving it to breastfeeding women. And there is nothing to do with breastfeeding women here, right? Be alert for any negative reactions. Reaction, it does not require any monitoring.
Any monitoring.
Which means you don't require any monitoring for reaction, which means reaction is very negligible. Is that clear?
Yes, Father.
Father.
Cool. If you need to visit any of the slides, you can let me know.
Father, third slide.
This one, right?
Yes, Father. Can I explain Father once more? Because I was bit confused regarding that must scale is given, Father. So why cannot
What must the register nurse do when a patient is discharged? What she must do. So what is the problem?
Father,
And must.
paragraph, yes, Father. They have mentioned the nurse register nurse must make sure that all relevant documentation is completed and accurate. So why cannot we select for that answer, Father?
Sorry. Anyone can explain it? Those who understood, let me see.
Yes, Father.
She is saying the nurse must ensure that all relevant documentation is complete and accurate. Okay.
Yeah, Father, you explained that
yeah.
in the answer.
Now, yeah, please.
We said in the answers, it was giving us one portion of all the information in the text. So it was one aspect that was mentioned. But in the text, talked about so many things. So that was a general information. So we cannot equate the general information to one portion of it. That is after only after the charge. So after care instruction was one part of the entire information given in the text. That's why we did not now adhere to the instruction of we looking at must, which is also reflecting in the text to pick that answer.
Exactly. You are perfectly right. Now, someone asked me, the problem is they have what must the registered nurses do? You are saying there is a must, and here there is a must. But when the must is given, you don't have this must in the answer options. The whole statement is not in the answer options. Answer option is speaking about particular, whereas the text is speaking about honor, means in general. Okay?
Father, absolute is also there. Absolute is also there.
Absolute in the text doesn't mean, okay? The absolute in the text, you don't worry. You do not consider at all. Absolute in the answer options is an elimination strategy. In the text, it can be there. No issues. Okay? The registered nurse must ensure that all relevant documentation is complete and accurate. All relevant documentation is not aftercare instructions. Aftercare instruction is one of those all documents.
Yes, Father.
So I have explained this more than 10 times repeatedly and uploaded the videos. I have been stressing it so many times. See, for example, I am telling all these OET aspirants who are attending today's session are genius. And answer option says, one of the OET aspirants admitting today's session is that correct?
No.
Or the text says all the OET aspirants attending today's session are Buddhus. And the option says the 3 of the OET aspirants attending the session today are Buddhus. Are they same?
No, Father.
No, Father.
Yeah.
No.
So text says all, option says 1. Text says all, option says 2. Text says all, option says many. Text says all, option says most. None of these are correct. If you remember the scales, which I taught you repeatedly, all is not 1, all is not most, all is not many, all is not majority,
All is not few.
all is, all is not few, all is not a few.
Not some.
Yes. Oh, how many times I have spent on these scale expressions. Only thing, you need a lot of patience.
Patience.
See, the whole today from 4 o'clock, the system was testing my patience. Everything, patience must be there. I could have postponed, but I said I should prove my patience, right?
We are learning
Because
patience from you, Father.
I was trying to highlight, but it is not highlighting because this is not my system. It's not helping me. Like after clicking, after a couple of seconds, it highlights. The click works. So that's cool.
Further, can you explain the last slide, 6th one?
6th one, the protocol instructs maternity staff administering Ferinject to temporarily discontinue prescribing tablets, avoid giving Ferinject to breastfeeding women, be alert for any negative reactions. Protocol for the use of Ferinject during pregnancy. Now, who is given Ferinject?
Maternity staff.
Maternity staff.
No, maternity staff is giving. To whom? Who is given? Not who is giving. Pregnancy. During pregnant means pregnant woman, right?
Yes, Father.
Yes.
If you are speaking about pregnant woman, can the same text speak about breastfeeding women?
No.
No, Father.
No.
No. You are supposed to care only for pregnant women. Then why do you bother
Pregnant
about
woman.
breastfeeding women?
Breastfeeding, yeah.
Got it. Pregnancy is the issue here. Pregnancy is the issue here. First trimester, second trimester, third trimester. Is that clear?
Yes, Father.
Yes, Father.
So
Yes, Father.
avoid giving it to breastfeeding women is not given. And side effects, reactions, it does not require any monitoring.
Any monitoring, there is only chance
because
for
the
one
side
person.
effect is very negligent. Be alert for any negative reactions. No, they said 1%. Less than 1% passes into breast milk. Less than 1%, not even 1%. Is it significant?
No, Father.
No, Father.
No.
No, Father.
So that's negative reaction is less than 1% means you do not bother at all. Even when you drink your Coke or Pepsi, you have more than 4% of side effects or problems. Okay, so don't worry about this. Less than 1%. Is that cool?
Father,
Yes,
Father,
Father.
here in the B option, saying that avoid giving it to breastfeeding women. So here in the para, it should be avoided in the first trimester. So
First trimester of pregnancy, what is it?
That is first
Trimester.
3 months.
3 months.
First 3 months.
First 3 months of pregnancy it should be avoided.
First 3 months of pregnancy, has it got any connection with breastfeeding?
No, Father.
No, Father.
No.
No, Father.
Not linked.
Okay, Father, got it.
Got it. Yeah. So sometimes it happens, you know. It's a very simple logic or thing that you know. But then when you speak of first trimester, okay, first 3 months you must give it to the breastfeeding. Even breastfeeding doesn't happen in this text at all. That's what I said. The heading or the topic sentence, if it speaks about a particular category, nothing else will be spoken in the same text or the same paragraph. Only that will be spoken of. The age-old example I gave you, if the text says Mahatma Gandhiji is the father of our nation, the topic sentence speaks, the Mahatma Gandhiji is the father of our nation. Father is the keyword. Father of the nation is the controlling idea. It will speak only about the paternal aspects of Mahatma Gandhiji, nothing else. Not about his education, not about his upbringing, where he was born. Nothing of these things will be explained there. But which will that particular text or paragraph will explain only why we consider him as the father of our nation. So the heading, the topic, title is important. That restricts, controls the text. So if you go into the paragraph structure, there are so many videos in our channel. You will understand that. Then you will get a lot of idea just by reading the heading or the first topic sentence. You will get maybe not less than 40% of the marks, correct answers, without reading. Here also we have seen 2-3 answers we had in the topic sentence itself, first part itself. Is that clear?
Yes, Father.
Yes, Father.
Yeah.
Father, can you go on the second slide?
Second slide, yes. About breast pumps. These means breast pumps should stay on the allocated ward except for when they are being cleaned. You can take it outside only for cleaning purpose. Otherwise, never ever remove it. Don't send it to the next ward. Don't give it for somebody for feeding. They are exclusively for use in infants ward area. Exclusively for this particular area. Don't remove it from this area. Restricts their removal from the ward. Is that clear? They are repeating it. These should stay on the allocated ward. They are exclusively for that ward. Should not be given to parents. Again, repeatedly they are telling you that restrict their removal from the ward. You cannot, you should not, you must not remove them from the ward.
Okay, Father.
You know, the problem is this, you have to understand, OET will give you 2 right answers. Out of 3 or 4, 2 right answers, but only one is correct. So the golden rule is, the monkey needs exactly the correct one.
Yes.
It is exactly the correct one. The other one looks almost, okay, it is given there, but there will be some slight change. Maybe they are saying 6 are injured and that option is saying 5 are injured. They are not same, right? Text says 6 people are injured in the accident. Option says 5 people are, or option says some are injured. Some are not 6. Okay?
Yes.
Maybe there were only 6 people in the vehicle. So it's not some are injured, all are injured, right?
Yes.
Okay.
Yes.
No, OET, IELTS, TOEFL, OPT, all these are tricks. You don't require hard work here. You need smart work. That's what you don't understand. You need not do. Maybe recently somebody was sharing their experience live. Who was that? I don't remember the name. That particular person has done only one reading text full before the exam. Only one sample material done before the exam. Only one. Before that, she used to do one paragraph, practice that way, understand it, then finish. You don't require a lot of practice. You need to understand these techniques.
Yes.
Write down. Even I don't mind if you copy the text. No issue. Recently, that Jainama was saying she had no chance of taking photocopies in the place where she was working. So she used to write down from the telegram. That was the great advantage she had. So first attempt, she could clear it because she was writing down the text. We go and take a photocopy and keep it. You don't, sometimes, most of the time, you don't concentrate on anything. You just read. But when you are writing, definitely you will understand the things. So don't worry, you can write. Do you know how much time I spent on these PPTs? Copying it from the PDF, correcting it, highlighting it, putting in the box. All those things takes time. You need patience. But how beautiful it is. Simple and beautiful, provided you have the patience. Otherwise, you will do hard work and fail. This needs smartness. They will trick you. You should be tricking them. I think cool, right?
Yes, Father.
And again, our platform as a tradition, once you attend the session, you are supposed to go to the main Telegram group and teach at least one small point that clicked your mind today. Take the screenshot. Otherwise, somebody who has taken the screenshots will share it there. Take one screenshot and tell them, see, today I found out this general statement and particular statement. There is a difference. When you highlight it, those people who have not understood will understand, or those hundreds or thousands of people were there will benefit. Okay. That's how we empower each other. So every time when you attend a session, make sure that you go and at least tell them one lesson. I don't tell you you should summarize everything that you learned today. Maybe something new what you learned today. If you have not understood anything, speak out there. We will understand that you haven't understood anything. Okay, so that we will make it more simpler next time.
The way you are explaining really good, Father. That see, when we are taking some exams, to sit for model exams, we are scared to take the exam, and really, it's really unable to complete the reading part itself. We are not coming for the conclusions for the question, and this will be the answer like that. But when you are giving the explanations, and it's really clear that this thing, Father, we can easily get past. This is the first time I am sitting like this conference and the class. Really good and nice, Father.
Okay, the thing is, the difference always I used to tell you, what I am imparting is knowledge, not the skill. Nobody can give you the skill. Nobody can teach you the skill. We can only give you the knowledge. And repeated, consistent practice will break it a skill. For example, driving. What can somebody teach you about the gear system? The clutch and brake and accelerator. Then the steering, left and right, only two side movements. That's all the knowledge. But next day you cannot drive. Telling that I know these are the 5 gears, and this is clutch, this is brake, this is this one. Can they drive? No. It will take days, weeks, and months together to acquire the skill of driving. Or swimming, only 2-3 movements with the hands and legs. I teach you, this is so simple. Come on. 1, 2, 3, 4, done. If you jump into the deep waters, what will happen?
Really?
Yeah, he will die. So what I am saying, this is a common complaint. You say, Father, when you teach, it's very easy. It's easy, but you have to understand, you have to work out. I always tell you, take the same material, this material which I taught you, work it out, write down the details, and try to understand yourself without looking at your notes which I have written down now. Try to do it yourself. Try to identify the things by yourself. That itself is a great practice. And write down, highlight. And I used to say there should not be even a slight space where you can put your pen needle somewhere in your text. You should be highlighting and scribbling so much so that it enters your head. Visualization is the greatest power. Only 90 or 100 of you will attend here. Thousands of them are left there who has issues with their duties. Being nurses, they have duties they cannot attend. Most of the hospitals may not allow these things. So unless I upload, these people keep on asking the same concerns. Okay, that's why I try to upload. Now, for example, today's video, if it is to be uploaded, it will take 8 to 10 hours to edit. Everywhere there are distractions and problems. So what I plan now, if at all you want to do it, you can take assistance from somebody with a nominal payment or something. If you are ready to do that, I will not involve in that. For editing purpose, if you can contribute something and place an assistant who are working, like maybe if you pay some 100 rupees per month, will be cool. I think there are so many people. If a couple of you, maybe 5% of the people learning here give some 100 rupees or so, we can employ somebody to edit the basic videos, which will give me a lot of time to give you sessions.
We are ready
If
for
you,
that.
yeah, if somebody can take it up, I will not accept any money. That will go to the same person. You will send it to the person who is doing it. I will not accept, because our policy in the platform is we will never do that. Why I thought of this? Because so that I can give you more sessions, because there are so many hundreds of them coming newcomers. You see, they may not understand now scale, all these things. I am not at all teaching these days. So I understand the beginners are finding it so hard. Beginners
Really,
session.
Father.
Yeah.
Yes,
So
Father.
I have to
Father,
care for the advanced, the exam preparation people, the beginners. So maybe if instead of me spending 8 hours on editing this video, I can give at least 4 sessions.
yes, Father.
That
That
will
is
be
very
much
important
Really,
for
greater.
Father.
us.
We will not accept any money, or we don't have an account at all to accept any fees. Or if you make it
I was thinking, Father.
We want your session more, Father.
Really, Father.
by
Because
account.
your time is precious, Father.
Okay. There are thousands of people. I believe more than 1,000 people who have passed from this platform. Maybe every month, at least 20 people passing this platform minimum, whom I know. Many of them don't even improve. We don't get connected because they learn from, sometimes they attend the session, sometimes they go to the videos, then learn and go. We don't get any connection. These days, hundreds of beginners are asking me, Father, you said scale. Which scale? 30-inch scale or 15-inch scale? They don't understand what it is. Or you said modal verbs. What is that? You said after contrast word. What is that? Because recently we have not taken beginner sessions. Now we have to start a new batch. Already we have started.
Yes,
we have to give them sessions. Yeah.
After 1 month waiting, this is first time I'm attending your session, sir.
Okay. Don't worry, we will be able to give more and more sessions.
Father, really, Father, we will do that, Father. We will do that.
Because your session is your session, Father, is like life-saving drug for our OET.
Really?
So we don't want to miss it.
Yes, definitely. Don't take any stress regarding OET. Just go take it cool and try to learn, enjoy it.
Father, really, Father, we are here to help, Father, for this, and you are really precious for us. To we need lot of classes from you, Father. For that, whatever help we can do, Father. That.
Yes, definitely. So what we'll do?
One video you said, Father, that you are spending for one video editing almost nearly 10,000 rupees, and you are not collecting even single rupee from the aspirants.
Yes.
You are really great, Father.
I paid, Father, before I paid one agency in India. I don't know their name. I paid him 22,000 Indian money. I send it from here. But when I started the classes, reading part A and what is the guideline, what is the standard, he was just telling this is the answer, this is the answer, this is the answer. So when I was searching, when I came to Edu, when I become a family member of Edu, from that time to till now, there's a lot of things I search in like not there. Even the other British like platform, it's also not there. Only this platform, Edu Skills, they have everything. If you sincerely attach to them, and if you want really, the guide is the Edu Skills with the guidance of your Father. So I'm ready here to support each and every aspect, because I want your session. After 1 month waiting, today I attended your sessions.
Really.
Second thing, what I wanted you to emotionally support those who are really weak. There are so many hundreds of people you may not know, but I know them because I am not even able to answer them their responses. Every day I get 15,000 to 20,000 messages in WhatsApp and Telegram. So sometimes if you are ready, please enter. I will open the Zoom for you. Teach one thing what you learned to them. That's enough. One small thing, what really you learned to the group. So it becomes what, when you speak, it becomes easy. Otherwise, what they feel, oh, it's easy for Father, but not for me. Father is an expert. Father is an expert. So he understands, he knows. But when you teach from a learner's perspective, they understand far better. It can be in English or Malayalam or Telugu or Tamil or Kannada or whatever the language you want to. We will get such audience and a small group we will teach. Let's develop that. That will be very helpful because we used to do earlier. Later on, we could not, because of my hectic schedule, we could not coordinate these things. You can even take my own videos, my own PPTs I can give you if you need. You can explain one PPT to a group of people. A crystal clear lesson that you have learned, just explain to them. And whenever you find something of that sort, what is unwanted or spammers, only Sunita and me, two of Chief Admin and me, will post authentic things. If someone else posts, please send a message just after that. This is spam, don't entertain. Okay? Suddenly you saw such a message or a link or invitation for leaked questions, just alert the group members. This is a spam. And tell them only Father Saleen, the mentor, and Chief Admin Sunita, he will post the things here. Don't listen to others. Normally, we only two of us do it because you should not be confused. Though there are 20 admins in the platform, only two of us do posting in the main platform.
Yeah,
These
what
are the
we
helps
have
you
to
can
do, Father? No. This scam, this thing, messages, no. We are seeing daily basis in
what you have to
different
do,
names.
one thing, if you know admins, you have to alert the admin. You can even send me the message, or you immediately you have to give a reply in the platform. This is a spam message, so that the beginners, those who know nothing, they will think it is me who is. For example, they say Dr. Joseph. They will say it is Dr. Saleen Joseph. They will presume. They will immediately click the link and go. And there are people who have lost more than 5 lakhs of rupees from this platform. And many have lost lakhs and lakhs of rupees with the spammers. So just alert them, that's all.
Okay, Father. Really. I saw that like that messages, Father, but I didn't know what to do with that. Whether I can post any message or not, or
everybody should attack. Everybody should respond and say he's a spammer, this is spam. Creating awareness about spam messages. So let me know, even that you can, who want to teach a lesson, let us know what lesson you want to teach. Take a particular lesson and inform Arya or Sunita or any of the admins whom you know, whom you are in connection. Here you have Anjali, Sunita, Arya, Manju, Manu, then Shanmuga, then Sabari Lakshmi, any of these admins. April 15 days we have offline program. Next 15 days. Okay. And May.
Only in April, Father?
No. April. The offline is in April 5 to 21st. 15 days. That's in Bangalore. If you want to keep an offline somewhere in your place, you can definitely, we will come. Okay, God bless you for your initiative, because we want to keep our platform, charity platform. That's why we said we will not connect. For example, recently somebody from America, he said he has spent more than 15 lakhs on OET and he would like to give at least 1 lakh to Edu Skills. I said, no, we don't accept. We don't accept any money in that way. Then our focus will be on money and rich people. But our focus must be always on poor people. Yeah, not even a gift. Anything, not even a gift. Except for one thing I have to admit. The phone which I am using is given by my admins. I could not help it because they came here surprisingly, traveling overnight and all that. I had to accept it because if I reject, they'll be very sad. But there are so many people who wanted to give something, but I have told them now. Otherwise, I could have gone on a big system today, sitting in a studio and
every
speaking.
minute, second, you are receiving gift. You are receiving prayers for all of
prayers
from us.
And eternal,
So that is a big gift.
Definitely. That is there. That's definitely there. And the love, concern, everything we enjoy. Yeah, thank you so much. Yes, only thing, see that we try maximum to reach out to maximum people. You know, still there are so many people. Even recently I sent so many messages in the admin panel. They're asking what is the fee structure. Even if you go to YouTube comment space, you can find what is the fee structure. How can we join your classes? So many questions. People don't know even today. They are not aware it's a free platform. So try to reach out, share the videos or share the things to others. Be happy somebody passes because of our sharing. When so many of us are, why don't we reach out to everybody in this way? I think the whole world can benefit from. For OET, this platform is definitely more than enough.
Thank you, ma'am.
Thank you, ma'am. Thank you, Father.
Thank you, Arya, ma'am.
Thank you, ma'am.
Thank you all. Thank you, Father.
Thank you, Father.
Thank
Okay,
you, Arya. Thank you, Father.
Thank you,
Thank you.
Father. Thank you, Admin panel.
Thank you, Arya. Thank you,
Thank you, Ma'am
Sumi.
Arya.
Thank you,
Thank you very
Shanmugha.
much.
Thank you, Anjali. Thank you all.
Thank
you, Father and all admins. Thank you so much.
Thank you,
you,
Father,
ma'am.
and all admins.
Welcome.
Thank you all.
Thank you.